Good morning to everyone. Today we are going to discuss how to avoid mistakes in our day-to-day pharmacy practice. We are all human beings. Mistakes possible in any profession, at any place, in any level. How to avoid the mistakes? The intensity of the mistakes sometimes in low level and sometimes in high level. For example, high level mistake. A army man dropped a bomb in a wrong place. Just imagine. For example, low level mistake. Wife add salt twice in the preparation. In the case of medical profession, how to avoid mistake? Don't break your head. Just follow the instruction given by your in charge or the instruction given by certain institutions or organizations. For example, World Health Organization, Ministry of Health, Joint Commission, United States of America, Canadian accreditation. These institutions have done so much research, survey and systematic analysis, and they derived a set of rules and regulations, or they made certain principles and procedures to avoid mistake. We have to follow, just to follow. Number one, don't allow kids inside the pharmacy. Kids may play with the scissors, play with the labels, and may swallow tablets or some drug items which are in the dispensing area, may play with the rubber stamp, or you will be preparing every day so many preparations in the laboratory. They may throw a kind of material, maybe chocolate in the preparation. Then you have to dispose the whole preparations. So kids can do anything. We cannot imagine. They may disturb the computer system. So don't allow kids. Strictly not allowed. The mobile phones and visitors are strictly avoid in the pharmacy. In the refrigerator, don't keep food items, and the temperature must be monitored. You must have a checklist to check the temperature, and you have to follow. Sometimes we used to prepare small scale preparations in our laboratory. For example, calamine lotion. The technician should be always with you, and better to be two pharmacists while doing preparations, because you may miss one of the ingredient. We don't have quality control in the industries. After each and every batch, they used to take sample bottles to analyze and to estimate the active medicament, whether it is in the right proportion or not. If it is less than 95% or above 105%, the whole batch will be rejected. Or in the viscosity or disintegration, any issue, the whole batch will be rejected. But in our case, in our preparation, there is no quality control. No one will check. So you have to be aware of this. Calamine lotion have calamine, zinc oxide, bentonite, glycerol, sodium citrate, phenol. You may miss any one of the ingredients. So you must be very aware, and double check is very important here. Posters are very important in the pharmacy to give awareness or to give information to the staff members. LASA posters, atropine ventoline dilution posters, no admission posters. So these are all very important. Then, if you receive any new drug, just send a circular to all the staff members, the physicians and your technicians, and your colleagues, to everyone, send the circular. By that way you can inform to them about the new arrival and issue leaflets to them. Avoid advanced packing in certain medicament. For example, Cafergat. If you make advanced packing and keep Cafergat, you have a look-alike problem. A similar medicine you have in your pharmacy B-complex tablet. The size, shape, physical experience similar in the case of Cafergat and B-complex. So there are possibilities for mistake. So don't keep Cafergat in advance. The pharmacology is completely different. It is for migraine and dangerous high alert medication. For example, you have Gubisone and Primosone. Both looks similar. You see the dosage of Gubisone in the case of respiratory diseases like asthma. The dose may reach 8 tablets per day, 4 tablets twice, or 3 tablets twice, or 6 tablets at single dose. So in this case, if you dispense Primosone instead of Gubisone 5 mg, what will happen? 5 tablets together, 6 tablets together, which has extra pyramidal effect. So you must be aware of all these. Patient education. Coming to patient education, it is very important. Patients sometimes coming to you and asking, I want the long white color tablet, I want the pink color tablet, yellow color tablet. No, the patient should aware of what medicine he is taking. He should have at least the photo of the medicine, or the empty strip, or the cartoon packing, so that we can recognize the medicine. The patient should know about it. And the patient should not insist to give the particular company items. We always see patient insist, I need Coram, I need Augmentin, I want Zyrtec, I want Citralone. What is the difference between Coram and Augmentin? The company only different. What is the difference between Alphacort and Hydrocort? Just the company different. The active medicament same. So, the patient should know there are different companies, but active medicaments are same. Who should teach this to the patient? Physician and pharmacist. There is no evidence, there is no documents anywhere in the world that this company is better than this company, like that. There is no document. So that here, this point of view, the patient education, very important. Rysec, Minisec, the same. Pharmacology is the same. Regarding name of the patient, you should check the patient first name, second name, and the third name. It is very important, because you find Sarah, different kind of Sarah. Sarah Muhammad, Sarah Ali, Sarah Ali Muteri, Sarah Muhammad Rashidi. So it is very important to check the name properly, and you should know the history of the patient. Whether the patient has a drug allergy, it should be on the system. The drug interaction is there, any drug interaction, the patient is pregnant, or the patient has any G6PD issues, or the patient has any chronic diseases like asthma, hypertension, diabetic, glaucoma. So these are all very important before you dispense to the patient. Incident report is very, very important, because it gives a feedback. It gives the idea. You can identify the mistakes. Then you can implement your policy and make precautionary measures, take precautionary measures. So incident report is very important. So I am requesting everyone to write more and more incident report to identify the issue. Misunderstanding with patient. If you have misunderstanding with patient, don't argue with him. Just leave the window and give the window to your colleague. He can manage. Because you should not discuss any matter when you are in tension. So better to avoid the window and give to your colleague. We are familiar with the FIFO, FIFO, first in, first out. In the case of expiry list. No, this is old concept. Regarding our Talavia supply, every supply you should check the expiry. Maybe the last supply have near expiry. So first in first out concept lead. Check every supply, the expiry, and note down the expiry. You must have a checklist for the expiry. Storage. In the storage, you use color code labels. See here, the drugs are in blue color. These medicines are used for chronic diseases, to lower the cholesterol level or antihypertensive agent. Here there are different stent. To highlight the stent, we use different color to highlight the stent. Similarly, look at the labels. Here we highlight with color the site of action or the formula: eye drops, eye ointment. So color code is very important. Look at the labels. The drug acting on respiratory system, in different color. Drug acting on GIT in different color. See the colors of the label. Color code is very important. Anti-infective agents are in green color. So it is easy to recognize your medicine and to identify quickly without mistake. Keep one magnifying glass with you always in your bag. If you cannot read the strips, small letters, each tablet contains so and so milligram, so and so milligram. Take your magnifying glass lens and look at that, focus and find out exactly what is the active medicament. So keeping one lens magnifying glass in every pharmacy is very important. If you have personally one, it is better. Eliminate the labels. You are dispensing it to the patient. Say Eltroxin 25 milligram. Patient say, I have with me, I don't want. Now there is a sticker, the sticker having patient name. You left as it is. You will find another patient and you try to dispense this, and you dispense by using the label the opposite side of the envelope. Now patient will get confused. There are two names in the both side of the envelope. He will get doubt the medicine is the right medicine or not. So better eliminate the label immediately or remove the label from the bottles immediately to avoid further complication. Don't keep personal medicine in the dispensing area. Always it's a headache. You keep any medicine, personal medicine, on the dispensing area, by mistake it may enter inside the packing. After removing one tablet, 9 tablets in the strip, you may dispense. It create a problem. No abbreviations. Abbreviations should not be used. HS at bedtime, SOS whenever necessary, BD, BID, TDS 3 times daily, Q6H every 6 hours. No need of abbreviations. I am not telling this. The World Health Organization and the Joint Commission of United States Accreditation Canada, they are insisting don't use abbreviation. Better to avoid abbreviation at the time of dispensing or during the prescription, in both cases. And you can maintain your system well. In the system, we have 3 different colors. The regular medicines, if it is active or inactive. Active this will appear in the system with yellow shadow. If there is any LASA issues, the medicine appear in blue shade. If it is high alert medicine, say Librax, insulin, different kind of insulin, Kefargat, there will be high alert red shade. So this will solve the problem to some extent, minimize the problem. There are different strength of the medicine and different color medicines. So you should be aware of LASA, LASA, LASA. Look, I like sound, I like. I have a chart here. Look at the chart. Here, LASA control sound like with prefix starting looks similar. The pronunciation, Zyrtec, Xyloric, Zantac, Ciprobe, Cipralex. Similarly, LASA control sound alike with suffix at the end, aldactone, ganatone, chistone, guppisone. Now, here we can differentiate the label with tall man lettering, capital and small, to differentiate the pronunciation sound like. Look like problem. We have Lipitor, Norvasc 5 mg, Passaging, Diflucane, similar packing. Duspetalin, Dicetyl, Hydrasec, similar packing. The physical appearance is same. There should not be any mistakes. So, such kind of item you should keep away from each other. Don't keep a Lipantil and Isoptin at one place. Don't keep Duspetalin and Dicetyl at one place. We can avoid the mistake. Similarly, there is a LASA issue with concentration. For example, Eltroxin, we have different concentration, 25, 100, 50, 112, 88 milligram, different concentration. And similarly, Concord Gestil, different concentration. And LASA control, sound alike with formulation. We have Olfen gel, Olfen tablet, Olfen injection, different formulation, Ventolin solution, Ventolin syrup, Ventolin tablet, Ventolin inhaler, different formulation. So we must take care because there is a sound alike problem. LASA control with needles, with the bandage, grub bandage, gauze bandage, open wound bandage, confirm bandage. So you should differentiate or you should keep in different places. Okay, whatever the storage problem, stock problem, we can manage ourselves. But there is another problem, I will tell you later. And see here, again, LASA with the generic atorvastatin, simvastatin, so many statin we have, so many pril we have, captopril, enlopril, lisinopril, omeprazole, pantoprazole, amlodipine, felodipine, propranolol, bisoprolol, atenolol. So these are all very important as far as LASA is concerned. So I said we can solve our problem in the storage ourselves. But in the case of dispensing and prescription, in between the prescription physician and dispensing pharmacist, there is a third party. Patient involvement is there. So take care because the third party is there. Here it is very important lead to complication. Then should have a demo kit in your pharmacy to explain in the case of inhaler how to use a different kind of inhaler we have. Discuss. You see Spiriva. In every case the mechanism, the procedure is different. So better to have a demo kit in the pharmacy. Don't cut the strips at all. Still we are cutting the strip due to some other issues. We must avoid this. Why? For example, say in the case of Diawan 80 and 160, Codiwan 80 and 160. How to recognize once you cut the strip, you cannot find out the tablet or the specific expiry or the strength. You cannot find out. It's difficult to recognize. So don't cut the tablet. Computer roll. We have now we have a supply of two kind of roll. One is in pink, another one is yellow color. The pink one used for the dispensing in the window. The yellow one used for laboratory is better because yellow one is having more sticking property. When you prepare alkaline ear wash, alkaline nasal wash, or hydrogen peroxide ear wash, hydrogen peroxide gargle, the bottle is having low sticking, plastic bottle have low sticking effect. So better to use high sticking property roll to avoid the issues. In the same day, don't prepare nasal drops and ear drops. Better prepare in different day to avoid the problems. So update your knowledge is very important in the medical profession. Suppose, for example, you should not get confused with Imodium and Motilium. Imodium is different, Motilium is different. The pharmacology is completely different. Imodium is used as antidiarrheal and Motilium is anti-emetic agent. Similarly, Celebrex and Cipralex. Celebrex, COX-2 inhibitor, and Cipralex is antidepressant. Sometimes you find more confusing medicament, active medicament. For example, mebendazole, metronidazole. The suffix are also same, the prefix are also same. Both start with M, both end with zole. Mebendazole, metronidazole. So you should take care of, you should have a knowledge, you should update your knowledge always. So far we discussed about the mistakes in our day-to-day practice. Don't confuse with the occupational hazards here. There are different occupational hazards like electrical hazards, chemical hazards, biological and physical hazards. That is a different topic. And we will be back soon with more and more information. Have a nice day. Thank you.